Mr. Garcia?
Yes, ma'am.
I'm Sharon Seymour. I'm the nurse practitioner in palliative care.
Nice to meet you.
How are you doing today?
Hanging in there.
Yeah?
I guess okay.
Do you know anything about palliative care?
No, not exactly.
Well, we're a service that the hospital offers to patients who have chronic illnesses or illnesses that affect their quality of life. One of the things that we do and we specialize is in symptom management. And your doctors and your nurses have let us know that you're having quite a bit of difficulty.
Yes, I am.
Can you give me some idea of what's going on with you?
I'm just very uncomfortable, a lot of pain, a lot of discomfort.
Okay.
Can't seem to get comfortable in any position that I really am into.
Okay.
So I just uneased and just uncomfortable in general.
Okay, so we can work with your pain and try to get your pain under control so that you're a lot more comfortable. Are you able to get up and move around pretty well?
As you can see, I try because it's just I'm aching all over, so it's just difficult.
Okay.
I try to cope.
All right, so
manage it.
So one of the things that we use is a pain scale.
Okay.
If I was to ask you if 0 is no pain or 10 is the worst, how bad would you say your pain is?
Overall, or at times, or
right this minute. Let's use right this minute.
Even though I'm sitting here talking to you, I would say a 9.
That's pretty bad.
Yeah, it's uncomfortable.
Yeah.
It's not easy, but I got to go on.
Right. Okay. Well, let's see what we can do about that. Okay. Can you describe the pain to me?
Comes and goes. It's sometimes sharp pain, sometimes goes over my stomach from one side to the other, or lower back, or I can't sit comfortable for a while. I got to move around or try to stretch. It's difficult standing up sometimes and just trying to stretch out, so it's hard.
So moving around and shifting your weight, stretching out sometimes helps.
Helps a little bit. It puts me at ease a little bit.
All right. So. Any other symptoms that you're having with it? Any nausea or vomiting?
Some nausea, no vomiting, but I don't feel hungry. I don't feel like eating anything. Try to drink to keep my mouth wet. It gets dry.
Your mouth gets dry.
So just more liquids than anything.
All right. Any besides the abdominal pain? Any pain in your chest?
No, not really. Sometimes when I cough or sneeze, I feel it, but it's not really bothering me in general.
Okay, good. I know you're having some difficulty with your bladder. Any trouble when you pee?
Sometimes it you go, you stop, you go, you stop. Sometimes it's irritating. It burns, or I don't know how to describe it, but it's uncomfortable. And
the medicine that they're giving you so far for pain, have you had any itching with it?
No, not at the present time.
Okay.
So it's helped. It helps relieve, but the pain's still there.
All right.
It's sometimes it's unbearable, but I'm trying to learn to live with it.
Well, my job is to help you learn without the pain as much as possible.
That would be great.
I don't promise that we'll get your pain completely controlled, but the goal would be to get it as controlled as it can be and make you as comfortable as possible. Okay. All right. So I wanted to talk to you a little bit about your illness. Okay. I know you've got the doctors coming in, you've got your nurses coming in, everyone's coming in and talking about what's happening to you. But I wanted to get a sense of what you know about what's happening to you. What have they told you?
Well, I know I've had cancer, and I had surgery, and I used to be an avid drinker, and I've been clean for a long time now, and I don't know if it's one of those things that is coming back to haunt me, or but at this stage of my time, things are happening now. I don't understand why.
Yeah. What are they telling you as far as being cured, or?
Well, I don't ask many questions. I haven't even consulted my family with it. In reality, it's been very difficult trying to tell them. Getting some help from spiritual care and trying to iron it out with them, even though my wife and my son are very against anything I'm deciding at the moment, but I just don't want to burden them. I don't want him to suffer or to go through what I'm going through. So
Right.
I just want to be comfortable if I can.
Okay. So you saying you want to be comfortable. If you had the choice, and you do have the choice of making decisions of how aggressive the care would be, what would be your decision?
My decision would probably be not to have any extended care at all, other than comfort for my pain.
Okay. So you don't want to suffer.
I don't want to suffer, and
But
I don't want my family to
you don't
suffer.
want your family to suffer either.
Even though I'm sure that they think differently and
Yeah.
otherwise, but
Yeah.
It's
So
a-
the
it's gonna be
reality
a
of the
very tough-
situation is they don't want to lose you.
no, and I really don't want to lose them. But if it comes to choice, then
Okay.
it has to be what it has to be.
All right. So you feel comfortable in making a decision that you want to be kept as comfortable as possible
Yes,
without aggressive measures.
without aggressive measures. Yes.
No attempts to, let's
No
say, if your heart
attachments,
stops,
no
you
heart
don't
stop.
want to be
All I
resuscitated.
would like is just medication for my pain and
Okay.
discomfort. Otherwise, I'm sure that my wife will disagree, and my son, most of all. But it's at this point in time, it's my choice.
Yeah.
So
Well, we will do everything we can to honor your wishes.
I like that.
Make you as comfortable as
And
possible. If you had a choice to either to go home with care versus going someplace else and being cared for, like a nursing home or like
Oh boy,
a
that'll be a
hospice
tough decision.
facility.
I guess if I had to, I would choose home, even though it will be a bigger burden on my family. But even though I'm here, I really like to be out of here. I'd rather be in a peaceful setting at home.
Yeah, that makes
instead
sense.
of,
Yeah. Well, why don't we see what we can do to help that and help your family? Because
Most of
if that decision's made and they're willing to accept that decision from
I
you,
pray that they accept.
yeah, we can work that out with your family and try to do work out the arrangements so that your wishes
Please.
can be met.
That would be my utmost desire.
All right. So what we want to do then, we need to talk with your family.
Okay.
Let's plan on setting up an appointment. We can
Sure.
have the oncologist come in and explain to you better, so you have a fuller understanding of what's happening with you, as well as your family, so they see exactly where you are in this process. We can have the chaplain there as a support to you and your family. We'll probably have a social worker and maybe a few other people, but let's sit down together and
Okay.
let's do our best. We'll do our best to get your family
Okay.
on board with your wishes, okay?
Sounds good to me.
That's very nice to meet
Thank-
you.
thank you. Nice to
And
meet
I'll
you.
work with your doctors today to get some pain medication so we get your pain better controlled.
Thank you.
Okay?
Thank you. I appreciate
Thank you.
that.